So our first speaker today is Emma, who is Head of Practice and Policy at the Nuffield Family Justice Observatory, and she's going to be giving us some insight into deprivation of liberty orders and where we are with those currently. There's been a lot of work and research done by Nuffield around this area, and I think it's really, really helpful. We've talked at length, and it's really, really important work that's been happening, and it'll be great to get some of your insights into this as well. I think Emma would really welcome that. I'll hand over to Emma. Emma's going to give a presentation, and then we'll have a chance for questions and comments following that. So over to you, Emma.
Good morning, everybody. It's a real delight to be here with you this morning and to see almost 70 people on the call, which is wonderful. I wonder if I might put some slides up at this point. Would you like me to do that, Jess?
Sorry, Emma, I was just getting the poll together. Yeah, if that's okay. And I can put the poll into the chat when you're ready, just around sort of the trying to grasp a bit of a snapshot of the service's first-hand experience of supporting girls on DOLS.
Okay, great. So I'm just going to pop some slides up here, and hopefully you'll be able to see them in a moment. Somebody give me a little thumbs up if you can.
Yeah, can see those, Emma.
Okay, wonderful, great. So as Jennifer has just introduced me, my name is Emma Smale. I'm Head of Practice and Policy at Nuffield Family Justice Observatory, and I'm going to present to you this morning on care for children on deprivation of liberty orders. I'm going to tell you a little bit more about what those are, as you will, I'm sure, from your practice be aware of the increasing use of these. But I will also tell you a little bit about the research that we have done in recent years and what that tells us about the children and young people who have become subject to these orders or who are at risk of having their liberty deprived via this particular route. So a little bit about us first. So the Nuffield Family Justice Observatory, for those of you who are not aware, is a centre which is part of the Nuffield Foundation. And we work to improve the lives of children and families by putting data and evidence at the heart of the family justice system. So what we seek to do is hold a mirror up to the system, and we do that really in three main ways. The first is developing an evidence base, particularly in areas where there are big gaps, and there are certainly some big gaps in relation to the family justice system. We also do a lot of convening, so we are really excited to be connecting with you today, and we often bring together different groups of professionals, both in the family justice system, but more widely across social care, health, mental health, justice, and so on. And we also do that in relation to developing innovations and getting alongside areas that are trying to do things differently. And we've been doing that recently in relation to children on deprivation of liberty orders. And I'll say a little bit more about that in a moment. So we've been working on what's been going on around the use and increased trend around deprivation of liberty orders for several years now. And we have developed the evidence base in this area, and we were the first organisation to really start collecting data and analysing data in this area. We were actually asked by the president of the Family Division, Sir Andrew McFarlane, to do some analysis on the numbers of cases that were going into the High Court. Because what's been happening essentially is that rather than children being accommodated under secure welfare, secure children's homes, which you will be familiar with, and other routes, more and more local authorities have been applying to the High Court via what's called the inherent jurisdiction. And this is essentially a little bit of a funny sort of feature, if you like, of the way our system works, that it's not designed to actually provide a statutory route with all the legal oversights that you would imagine for children. It's always been there as a bit of an add-on, a bit of a workaround. And so the increased use of DOLS is really a concern. So here is the real sort of stark reality of what we've been looking at. As you can see here in this graph, there has been a significant increase in the use of deprivation of liberty orders. since, in fact, it's a sevenfold increase from a very few 103 in 2017 to 18 to over 1,200 in 2024. The most recent data this year has shown that this sort of level, this number, is holding at around 1,200. And in fact, the number in the last quarter was higher than it was in the quarter last year. So this is not a trend that is going away. So what is happening here? So what we understand is that over the same period of time, there has been a reduction in the availability and the capacity of secure children's homes. So that's the legal route under the Children Act and the so-called Section 25. There's been increased pressure on that type of provision for a long time. I'm sure many of you will be very familiar with that. And there's also some evidence to suggest that there are children who are sort of identified to be too vulnerable to go into some of those settings. So those might be children with sort of in a mental health crisis or, you know, at risk of sexual exploitation. We also know that over the same period there has been a drive to decriminalise children, which is absolutely the right step, and we've seen a vast reduction in the number of children in custody, now around 450. At the same time, there's been a reduction in the number of Tier 4 placements, which is that level of CAM service where children are admitted to inpatient care under the Mental Health Act. At the moment, that's around 900 children. So as you can see, the numbers of children in deprivation of liberty orders is far, far greater than some of those other routes to deprive children of their liberty for a number of different reasons. So I'm going to say a little bit more about what we know about these children and the nature of the problem. So in our analysis, which we undertook of the what's now called the deprivation of liberty list, which is a court which sort of takes most of these cases, we did this analysis in 22-23, so bear in mind this is still a snapshot, but it is the best available data that we have, that anyone has on these children. And what we found was that this is a nationwide problem. As you can see, 94% of English local authorities made an application for a deprivation of liberty order in a 12-month period. There was, however, also significant amounts of variation, with some local authorities actually not applying for any DOS at all, and some rather more. So Jess has just put up, you might have seen the poll just pop up on your screen. Apologies, I should have introduced this, but we were really interested to know whether your service has any first-hand experience of supporting girls on deprivation of liberty orders. So if you don't mind taking a moment just to answer that poll, that would be great to see what your experience is in the room. So who are these children? So we know from the data that we analyse that the vast majority of these children are teenagers, they're in their adolescence, but there are, I'm afraid, some very young children who've been deprived of their liberty, in fact, as young as 7. But the thing I always say here is that we, of course, know that children do not stay the same age. So the children that are sort of present in this data, if you like, are of course now a couple or 2 or 3 years older. And so there is a significant question about what happens to children at that transition point of 18 or 16 and 17. Where are they going? And we don't know. So complex lives, not complex children. This is incredibly important because what we understand about these children is we're talking about intersecting, overlapping and synergistic needs. It's really about an increased acuity of need rather than one particular need getting worse over another. So as you can see from that list there, you know, there is a range of risk factors and needs that are overlapping, things that you'll be familiar with from your practice, things like going missing, self-harming, very poor mental health, also disabilities and learning disabilities and evidence of neurodiversity, but experiences of extrafamilial harm, as well as histories of adversity and experiences of abuse and neglect. So that we know that actually there are sort of roughly, and this is what we have from our existing data, sort of three groups. The first is around half of the numbers of children we analysed. You might say that they were children who had experienced extreme adversity, abuse and neglect in the home, and would have also now be very much suffering from developmental complex trauma. The other two groups would be roughly a quarter. So a quarter of children who have severe disabilities and or learning disabilities, and the other quarter of children who you might say have been sexually exploited or criminally exploited. So those are three groups that we can kind of, you know, roughly separate out, but I will emphasize that that grouping shouldn't be taken too literally, because you know from your work with young people that those needs and experiences absolutely intersect, and often they're not necessarily known or understood when children are first known to services. And we also know that these children have been involved as services for a very long time. So these are not necessarily children who we haven't worked with before in all our respective systems. The vast majority of them are in care. Quite a high proportion have come to care relatively recently, perhaps not surprising, thinking about the fact that most of these children are older. But important to note there, therefore, what's going on in adolescence and the fact that children are very much connected into their families and communities. But we do know that when they come into care, they do have, I'm afraid, very, very disrupted care history. So multiple placement breakdowns, as you can see, over 55%. It is also evident that children and carers have very limited voice when they become deprived of their liberties via this route. So we can see here that unfortunately children are really often very unaware of what's going on. They're not informed, and we even have evidence that once they become deprived of their liberty under an order, they don't know that that's actually happened to them. We also know that parents and carers are not legally represented at any hearing in a dole case. That's a very, very high stat, 88%. And that's significant given that we know also that there are a good number of children looked after via Section 20 opposed to care orders. So parents have given their permission for that to happen. Now, in a moment, I'm going to show you a film, which is something we have collaborated with an artist, Trevor Nielsen, on. And Trevor worked with a group of children whom we are incredibly grateful to, along with the local authority who supported them. And what you will see is that the experience of being on one of these orders is unfortunately not at all positive. But in many, many cases, we're talking about extreme isolation. Children are out of education. We're talking about high ratios of staff to a child, 2, 3, sometimes 4. Very inexperienced, often agency staff, because these placements are frequently in unregistered and unregulated homes. So in these circumstances, children have extremely limited agency, and their freedom to do normal everyday things is curtailed. And unfortunately, that situation can be really quite long and lasting for many of these children, as you can see here. With actually 32% remaining on these orders for over or up to 12 months, and then a 20% over 12 months. I've even heard of cases of children on orders for more than 2 years. So to note a little bit more of a positive point, there is now a lot more understanding that this situation has become a workaround as a response to the lack of sufficiency and the lack of capacity to work with children earlier, but also to find safe, appropriate accommodation in the community for them. There are a number of organisations right across the country who are working hard between health and social care, but also linking into justice and other colleagues to think about different ways of working, not just when children are deprived of their liberty in these welfare settings, but also to prevent this from happening at all. And we have developed a document called the Principles of Care, and I will put that in the chat for you, which has been developed by some experts, which really does show what's lacking now in the way we're caring for children and what is needed. And those are some of the key principles. Stable, valued, trusted relationships, really thinking about the primary importance of those relationships, but also the primary importance of supporting those carers and professionals who know children best. And there are models now where that's a multidisciplinary team providing supervision and support and using tools like formulation to help understand collectively between the different professional groups what is a child's story, and so that they can really understand in a more detailed and nuanced way how a child has got to where they are and what is needed to move positively forward. We know that decisions around deprivation of liberty are made very, very short term and in a crisis. The vast majority are on that Friday afternoon where there are very little options available in terms of their care and support. Therefore, we know that much, much, much more is needed in terms of really thinking through what is the purpose of depriving a child of their liberty on welfare grounds? What difference will it make? And how is that integral to their care plan and the aims for them over the longer term? It goes without saying that the levels of trauma and complexity and vulnerability that the children in these circumstances present means that this is work for highly experienced multidisciplinary teams. Unfortunately, we're seeing almost the polar opposite in some of these situations. And as I've said, as we know, too often in a crisis, children have almost no or completely no voice. So actually the importance of involving children, hearing from them, enabling them to speak and to have a stake in their own lives and future is incredibly, it should definitely be a priority. So those are some of the areas that we have been working with a peer collaborative, a group that has been convened involving some national government departments, the Department for Education and NHSE, and not so much the Ministry of Justice. And I will say there is a little bit of a gap around the way that the thinking is happening at a national level about what to change for these children. In relation to different legal routes and different professional groups who might be working with these children at different points. So I'd be interested to talk with you a little further on that. And before I finish and show you the film, just to say that there are some plans for reform currently on the table. You will be aware that there is a Children Wellbeing and Schools Bill currently going through Parliament. And in that bill, there is a new provision under Section 25, a new power to deprive children of their liberty, but in a different type of accommodation, which is currently called relevant accommodation. In that relevant accommodation, the aspiration is that there will be highly skilled staff enabled to look after children in the right kind of environment, and that these will be open children's homes with some particular conditions attached, so that deprivation of liberty powers can be used if and when needed. There are lots and lots and lots of questions at the moment about how this will work in practice, and there aren't any clear decisions about what it needs to look like, how it will be funded, and indeed how the wider issues around capacity of the system, not just the availability of care, but also the capacity and the skills to look after children in the most skilled and appropriate and loving ways. That all remains to be worked through. Okay, so I'm going to stop presenting, and we're going to move to a film.
Jasmine, if you could just stop recording at this point, please, while the film's on, that would be brilliant. Thank you.